Hi, my name is Robert, or Dr. Plourde, and we're here today to talk about comprehensive oral treatments, or COATs, and your pets and why it's important. So a dental or a comprehensive oral treatment is a general anesthetic procedure in which we fully anesthetize your pet in order to clean the teeth. The reason teeth cleaning and COTs are important is because tartar and plaque accumulation can lead to gingivitis, which is inflammation of the gum line. When the gum line gets inflamed, bacteria gets into the bloodstream, can exacerbate disease of the liver, of the kidney, of the heart. So it's just really good preventative medicine, and it helps add years of good quality of life to pets. Here at Boulevard, we perform the gold standard for dental procedures or comprehensive oral treatments on every pet, which is set by the American Animal Hospital Association. And that includes pre-op exams and blood work, general anesthesia, and x-rays, full mouth x-rays. The reason pre-op exams and blood work is important is so that we can minimize risk of the anesthesia. So if your pet has an underlying condition like liver or kidney disease or heart disease, those are things we need to know about before anesthesia so that we can perform it safely. In a cleaning, there's a lot of bacteria that's aerosolized and put into the bloodstream and those types of things, and an animal can aspirate that and get pneumonia. So it's really important that we protect the airway. But also the only way to truly effectively clean the teeth is when an animal is asleep. And most animals won't let us clean that without general anesthetic. So those are some of the reasons why general anesthesia is important. X-rays themselves are important as well because sometimes we can't tell if there's actually a problem with the tooth. So an X-ray allows us to see the root of the tooth and understand if there's something going on there like a cyst or a broken root or something that might be painful for your pet so that we can fully and completely address your pet's concerns. So the day of the procedure, when your pet comes into the hospital, one of our veterinary technicians will admit your pet. They'll take a thorough history, make sure everything's going well at home. At that point, a veterinarian like myself will then examine your pet as well as review the pre-op blood work just to make sure that everything's looking good for the procedure. If everything's looking great, we'll go ahead and give what we call pre-medication or a little bit of a sedative ahead of time. That allows your pet to relax while they're in the hospital with us. It also helps manage pain later in the procedure if we need to remove teeth. After that point, we'll place an IV catheter. That allows us to have venous access to get fluids and to help get more medications and have emergency access just in case. And then we'll move forward with anesthesia. Like I mentioned earlier, all pets are intubated to protect their airway, and then we'll clean and polish their teeth. One of our technicians does the cleaning and the polishing while another technician is monitoring, and while the veterinarian like myself is supervising the procedure to make sure everything's going smoothly. And it's at that point where we'll determine if there is an extraction that's warranted or not. So some of the things we're looking for during a procedure involve a few parameters. So part of our procedure is we probe each individual tooth. So I like to think of that as an individual tooth exam. And we also take an x-ray of each tooth. And it's those two things that help us determine if a tooth is viable or not. We all abide by the American College of Veterinary Dentistry guidelines that help us determine if a tooth is viable or not. So some examples of why a tooth might not be viable would be if it's fractured and there's pulp chamber exposure, which can make the tooth very sensitive and painful and prone to infection. Sometimes cats can get resorptive lesions, which are kind of like cavities, which can be really painful. Sometimes there can be a cyst around a tooth that can cause pain or infection. Occasionally we can see other painful conditions where there's root exposure or gingival recession or things like that. So it's a combination of that probing and x-rays that helps us determine if a tooth is healthy or not. And if it's not healthy, we'll remove that to help ensure the long-term health of your pet. So after your pet's procedure, we'll recover them from anesthesia and keep them in the hospital for several hours. The purpose of that is just to make sure that the effects of anesthesia are wearing off appropriately and your pet's doing well. And as long as that's the case, then they're usually okay to go home sometime between 4 and 6 p.m. that day. If your pet does have extractions, we'll ask that you come back for a complimentary recheck about 2 weeks later just to make sure that everything's healed appropriately. Of course, if you have concerns before that about discomfort or any odor or discharge, of course, we can always recheck sooner as well. All right, thanks for joining me today and just learning a little bit about what's involved with a comprehensive oral treatment here at Boulevard. If you do have any questions or concerns about what's involved with the dental procedure or with your pet, don't hesitate to give us a call.